Welcome back to Twin Cities Live. So this weekend is Mother's Day, which is beautiful, but it can also be a complicated holiday for a lot of people, and particularly challenging if maybe your mom is caring for someone with cancer or is dealing with the disease herself. Unfortunately, it's all too common.
That's right. So to make things easier on you, we're joined by social work manager Nicole Marcoulier from Minnesota Oncology with some gift ideas for your caregivers or someone going through a challenging time. So welcome in.
Thank you.
And I'm glad that you broke the ice, that you did not bring margaritas for us.
No.
So that is fine. You
Please
still have some great information for us.
Yes.
We're still very happy that you're here.
Yeah.
Now, this is really important to think about. You know, a lot of like Mother's Day, Father's Day, stuff like that. We just think about, oh, this is just perfect times and everybody's like so jolly and good, but that's not always the case. So this can be really challenging for some moms and caregivers out there. So one of the first things you mentioned is maybe a good gift is just listening.
Yeah, for sure. I think a lot of times with people have the best of intentions, say, oh, you look so great, or you know, you're so strong, and moms are really good at wanting to make everyone feel good. So it can sometimes shut down the conversation a little bit. So just reframe it a bit. Say, how are you really feeling? Like, what's really going on today? Checking in with them, letting them just talk, vent. It's hard. It's hard work going through treatment. It's hard work being a caregiver. Just validate that feeling. We can't fix this, but we can just be there for them and let them be really themselves.
Do you think it's particularly hard for children to look at their mom? I mean, because as a child of a parent, no matter how old your mom is, you just have that expectation that they're going to be the one that takes care of you, because that's how you learned to live with them, you know?
Yeah.
And so when that script sort of gets flipped, it can be kind of uncomfortable.
Yeah, and it's uncomfortable for the mom too, right? Like we want to be the caretaker even when our kids are grown up. So it can be hard to really express how challenging it can be. But just be there, just listen, just let them know that it's okay.
Yeah, and I think on the flip side, a lot of men out there feel like they're the fixer. Right, and they feel like they need to go into some of these situations like, oh, I can fix this, or I got a strategy to fix this. And sometimes, you know, with as serious as these conditions are, this is not something that we can just fix. I mean, this is all for the doctors. So
and that's okay.
Yeah, and that's okay. So what do you think, outside of just the listening, the validation, maybe just, you know, being there to vent, some gift ideas that you think are fun?
Yeah, I mean, there's always just like the comfort items, those long treatment days, entertainment. Those just really practical things can be great. But I think Mother's Day is a great opportunity just to, what would they like? What makes them feel special? What's a little token to remind them of how much you appreciate them? And it's a great opportunity to just take charge of the day this year. You know, if they have a lot going on, they're not feeling well, make the plans, make the reservations, show up with the meal, show up with the margarita, and make room for rest. If they need a little bit of time to take a break, make room for that in the schedule. For
I'm interested in your perspective on this idea, and I've done this too, and then I'm trying to figure out how to do it better when people are going through a hard time, and then the tendency can be to say, let me know what you need. Like, let me know if you need anything, we're here for you. But then it's sort of putting it on that other person to tell me what they need. So how do you just go forth and do something without, like, I don't know, kind of infringing on them or not really respecting their boundaries? I feel like this is tricky.
It is tricky. I think there's a couple things. One, if you are the person who needs that support, I always say put a list on your fridge. So if someone shows up, oh, can you just check the list? That's, you know, I feel a little awkward, I don't want to ask. Just check my list. Or, you know, if you're the one offering support, hey, I'm stopping at the grocery store, what do you need? Or I made this extra dinner, let me stop by. And you don't even have to come in the house, right? I'm going to drop it off, I'm going to leave it for you, and just make that a little bit easier. Just make an offer. What's this? Your neighbor needs some help, I'm going to grab your garbage cans tonight. Like, just without asking, don't wait for them to ask. Because a lot of people do feel uncomfortable letting you know, but most people could use a little extra support.
I think that's kind of just like how we're all built. You know, we don't like to ask for help, especially when it comes to gifts. You know, like maybe kids are a little better during Christmas time. There's a whole laundry list of things that they want. So you've talked about the patients. You know, what about the caregivers? If you're in a situation where you're with a caregiver and they can feel exhausted too, maybe they're not the patient, but what can you do for the caregivers themselves?
Yeah, I think we talk a lot, or you probably all hear a lot about boundaries. We talk about communication. This is a great opportunity for that. If you're the person in need, tell your caregiver, I really need this help, I really don't need that. Be really clear so that they're not just guessing. And then if you're the caregiver, find a buddy, find a friend who can just let you know if they're noticing it seems like you got a lot on your plate. And then check in with the caregiver. Have you eaten today? Are you sleeping? Hey, how about we meet and go for a walk? Check in with them and on their mental health. Like all of us, right? It's our responsibility to check in on other people, and in these kinds of cases, it's especially important.
Well, and I think your point about time is so valuable, that it's not just about stuff. Like some people think like, I have to buy them a stuffed bear that says get well or whatever. And then the person's like, now I got to figure out what to do with this bear, you know, versus being intentional about, I want to spend some time with you, you know, or I'm here to spend time with, here are some ideas of some things that we could do together.
Absolutely. Well, and I always say, like, energy is like a bank, right? What we do adds to it or it takes away from it. So what can you do to help that person's energy bank? Moms want to go and be with their kids and do it. So I'm going to take your kid to practice today so you have energy for the game, right? Anything you can do to kind of keep their bank like loaded up so that when they do feel good, they can enjoy the time with their kids and their families and not the groceries, the cleaning, the running. That's a big gift.
These are all great ideas. And I love the fact that a lot of these aren't really including gifts themselves. You know, it's just, you know, just being there for somebody and doing the little things can make a big difference.
Yeah, absolutely.
Thank you,
All right,
Nicole.
thank you so much. So, Minnesota Oncology is Twin Cities' largest and only independent cancer care provider. This year, Minnesota Oncology is celebrating its 30th year of providing care to patients in the Twin Cities. They currently have more than 100 cancer care providers in 13 clinic locations.
So this weekend on Mother's Day, the annual Race for the Cure is happening. And if you want to participate or learn more about Minnesota Oncology, you can head over to twincitieslive.com. We have links posted for you there. We'll be back right after this.